Hello, everyone. Welcome back to another episode of the Ramos Law Difference Makers podcast, where I'm so blessed, so lucky to talk to cool people doing cool things every single day. I'm Dr. Jim Hoven, your host of the show, and today is absolutely no exception because there's one thing that I know, and that's that people need good places to go for good health care. And the community health center movement that's going on around Colorado is pretty impressive, even given some of our, we'll call challenging economic and political times. But this group plays a pivotal role in taking care of people who otherwise might not get the care that they need. So we're going to talk to the founder and CEO of Tepeyac Community Health Centers, along with the director of development. Here we have Mr. Jim Garcia, who is the CEO and founder, and then we have Kristen Weber, who is the director of development. And so hold on, you're going to want to listen to this. You're going to want to share this with people as you get a handle on it, because you may want to become a part of this, whether becoming a patient, becoming a volunteer. This is just a fabulous conversation that goes on today. So without further ado, Jim, Kristen, welcome to the show.
Thanks.
Good to be here, Jim.
So I want to start out by first getting just a little bit of personal background about you guys, because the work that you do, especially as a founder of this, it has to come from somewhere deeper than, you know what, I'm going to go make a crap ton of money, right? It's not a business per se. So if we can, I'd just like to get a little personal background where each of you maybe grew up and what your lives were like growing up, what led you to the place of wanting to get involved in this type of work.
Sure. So I grew up in Albuquerque, New Mexico. Came from a family of 11. So
11 children
11.
Or 9, 2 parents and 9 kids?
11 children.
11 children.
And so I think I grew up in a very, what I would consider middle class. We didn't have a lot. We shared a lot of clothes, but always had food on the table and always had a doctor to go to for medical care, or going to the dentist or eye doctor. And so I think knowing that we didn't have much, but knowing that we always had access to health care and dental care. And, when I got involved with Tepeyac, it became clear to me that was not a given for a lot of people. I moved to Denver as a teenager to go to Regis University. And
what did you intend to study there? So you're coming from New Mexico, you're coming over to Regis. Did you have a thought in mind, like why Regis, and what was that all about?
I just knew. I actually had a cousin that was going to Regis on a basketball scholarship, and I just thought it was time to leave Albuquerque. Had been to Colorado, loved the mountains, and thought it would be a great place to live. Didn't have too many in-depth thoughts in terms of what I was going to be doing, but I liked the idea that it was a Jesuit college, and that they really have that ideology of service to others. Mm-hmm. And so I think that along with what I grew up with, I think that's something my parents instilled in me. And then coming to Regis, I think that was just fostered. I had the opportunity. They had a volunteer program, a service learning program at Regis at the time, where I was able to volunteer at St. Anthony's Hospital in their emergency room on Friday and Saturday nights. And so I think at that point I learned that I'm probably not cut out to be a medical provider, but I was really impressed by the people that worked in the emergency room, and how they dealt with people in their most vulnerable time, and they provide this incredible care. And I think that was I think when I started thinking about the medical field, and to what extent I might be able to have an impact in that area.
That's powerful. I got to ask, where were you in the pecking order of the 11?
I was the third youngest. So
third youngest. So did I got to ask, did any of your desire to volunteer and do these things, because a lot of regular college age, 18 to 21, 18 to 22, that is not part of their curriculum, if you will, unless it's specifically to get into med school. Then you have to kind of get that stuff. But for a lot of them, it's about the college experience, if you will. With you being the third youngest, was there a lot of that volunteering time, giving of yourselves exhibited by your parents and then down through your siblings, or is that something that's kind of unique to you?
It was. I think I would say my siblings were all, I think, had that same mindset. One of my sisters became a physician, and she was actually worked at a community health center in Albuquerque, and so which is what Tepeyac is now a community health center. So she, of my siblings, I was probably closest to my sister, who was the doctor, and so I learned about the whole community health center movement. As we became moved from a small clinic where we started in a little renovated house to where we are today, but I learned about the community health center movement and how that was just making a huge difference in the lives of people.
So cool. We're going to dive into the community health center movement in a moment, but Kristen, tell me your story a little bit, a little background, little kind of how do we get here story.
Sure. I'm on a different trajectory from Jim. I'm a Denver native, grew up here in town. I'm the oldest of 3 children. And
where'd you go to high school?
Manual.
You went to Manual? Excellent. I'm
Yep.
Denver native too. Went to a small, tiny Christian school called Silver State Baptist.
Okay.
Long ago.
Okay.
So you went to Manual.
And went to college, and I've lived in a bunch of different places. But,
And what were you studying in college?
This is our commonality. We're both English majors. So,
okay. So you left that out, Jim. You left out the English major part.
Yes.
Okay.
So, I went to Colorado College in the Springs.
Yes.
And again, in contrast to Jim, had more of a somewhat direct line. I've gone in a bunch of different directions career-wise. But I do hold a master's in middle school education and taught for a number of years.
Very cool.
And
middle schoolers are tough.
they are, but they're a little less tough when you kind of join them.
If you can't beat them, join them.
Yep.
Nice.
So.
And so what moved you out of education and moving you towards more of this community health service direction?
Yeah, I actually really moved more into development work first. And
like
in
psychosocial development or
fundraising.
Fundraising development. Got it. Okay.
For schools. And in all honesty, as a teacher, I feel like I've tried all the hardest jobs. So teaching is super hard. Lots of homework. And I thought, well, how do I stay in the schools and maybe have a little more time for, at the time, starting a new family and all of that. And got into the development work, which I enjoyed, and did that for a time, and got to the point where I was ready for the next step and started looking for something different. I was working at an independent school, and independent schools are, while they are nonprofits, they also run on tuition. It's a tuition-based.
Is that like a Montessori program kind of thing?
It's a private school.
Got it.
Yeah.
Mm-hmm.
So, again, a slightly different flavor, if you will, of a nonprofit. Quite a few resources available. And as I was looking to do something different, I met with somebody who happens to be a person in common who said, well, Kristen, if you're looking to do something and you really want to do something special, you need to check out Clinica Tepeyac. And I said, what?
What is a Clinica Tepeyac?
I had never heard of that before. So with that introduction, further research, and then ended up visiting with Jim and talking, and really excited about this particular project. So the story, the origin story is really Jim's to tell, and I definitely want him to share that. But right now, to go from where our current clinic is in Globeville, it's a 6,000 square foot clinic, we're moving into a 24,500 square foot space. And it's part of a collaborative project that began with Urban Land Conservancy purchasing this land in the Ilarian neighborhood, and then the developer and Tepeyac, and together these entities have built this really phenomenal project. Which,
what a great story. Yeah, I definitely want to dig into that too. And so now, two-part question for you, Jim, with respect to the origin story. I want to first define what a community health center is, how it's different from another health center. Like if we say Clinica Tepeyac, what is that different from SCL? And for those people listening around the world and not in Denver, SCL doesn't mean anything, but it's a local brand here, right, of what healthcare is. Can you just describe community health care? What are those like? And then how did yours get started? How did you jump into the space?
So and I'll give you the very short version. The community health movement started back in the 60s. I want to say that in Boston, I think, was one of the first community health centers, and then Denver Health actually was one of the, I think maybe the second after Boston that
Wow,
that
I wasn't aware of that.
Designated as a community health center. So I think the community health center movement was really based on making sure that the needs of the most vulnerable members of our community had access to basic healthcare services.
And how are those defined? The most vulnerable, is that the people under poverty line? Is it people who are homeless? Is it the people with less education? Who are those folks?
I think all of the above demographics that you just mentioned. But I think the movement has evolved too, where it's the quality of care is so great that that people from all walks of life recognize that they're going to get high quality care at the community health centers. And so I think fast forward to where we are today, in Colorado, there's 20 community health centers, with Denver Health being the largest and Tepeyac being one of the smaller community health centers. But I think what we all have in common is that we provide a model of integrated care where we integrate the medical, the mental health, behavioral health, and dental, and in not all cases, but also integrate pharmacy as well. We're at our new facility, we're going to be adding a full-service pharmacy to our medical, dental, and behavioral health. But this idea that when someone comes to us, and I would say when we look at Tepeyac's, the population that we serve there, from a economic standpoint, these are families, they're working families, sometimes working 2 or 3 jobs, and sometimes healthcare doesn't fall into the list of priorities for the family, and they have to make those really hard choices in terms of where they're going to spend their resources. And so I think the whole idea behind the community health center movement was to make sure that vulnerable population had access to not just medical care, but also behavioral health care and dental care, and that as a working individual or working family, that they could access those services without having to spend an inordinate amount of time trying to schedule different appointments.
One-stop shop.
Yep.
And how did you jump into this in the first place? What's the brainchild to go from, okay, there was, these other ones here, what's the need? You're in college, you see that maybe not everyone has same access to care. Where does this thing get hatched, get birthed?
So I was a new member to Our Lady Guadalupe Church, which is a predominantly Latino parish in North Denver. Long story how I became part of that community, but it felt like a very comfortable place for me, given where I was at that point in my life. And so I went beyond just becoming a member of the parish community. I was recruited to join the parish leadership, the parish council, and I'll always remember the first meeting that I attended. The pastor of the church came in and said, and he was someone that was the spirit of the community was that of social justice and community service, and he said, one of the most pressing issues that we're facing, not just as a parish community, but as a community as a whole here in this North Denver area, is the access to basic healthcare services. He said, we have people coming by our church office almost every day asking either directly or indirectly about their need for medical services or mental health or dental. And he said, this was again 30 years ago. He said, we have very little to offer. We're a very a poor parish, and but we don't have that sort of resource to offer to people. He said, what we do have, we have this little rundown house that's next to the parish office. He said, wouldn't it be great if we could renovate that little house? It was a 800 square foot, 110-year-old North Denver bungalow. Said, wouldn't it be great if we could renovate the house and open it up as a clinic that could provide basic services?
So he had that vision.
Mm-hmm.
Did, and he said, and he ticked off a few other priorities, but he went back to the clinic idea. He said, would anybody be interested in taking the lead here? I don't have time to focus on that, but so I thought to myself, this seems like a really worthwhile.
What were you doing at the time?
I was working for the U.S. Senator at the time. His name was Tim Wirth.
Yeah, for sure.
So,
definitely remember that name.
So I was working a full-time job in the senator's Denver office, and as the conversation started unfolding for this idea of opening a clinic, it was about that time that the senator let everyone know that he was not going to run for a second term of office. So all of the staff in Colorado and in Washington were pretty much out of work. But the timing for me was perfect because that allowed me to really focus on what it was going to take to open up a clinic.
And what was that process like for you? Because you didn't have background necessarily in healthcare. It sounds like you were in the political arena, so you would have understanding of how things work and how things move and all that. But what was your strategy to get this up and running? What things were you looking at for services? Like, how did you go about that?
It was interesting. One of the issue areas that I was focused on for the senator was healthcare policy, and so I started to learn more about some of the inequities around healthcare and some of the challenges around for communities and for families that were having difficulty accessing healthcare. And so I had my own understanding of what the issue was, but then I had that additional background from a public policy standpoint in terms of how things like Medicaid and Medicare and were influencing people's ability to get basic health services. And so early on, it was just me not having a healthcare background, talking to people in the healthcare field and say, okay, this is what we're thinking about. What can you advise? What is the likelihood of being able to open up a clinic like this?
Did you have to pay the providers, or did they volunteer, or how did that work?
Originally, it was all volunteer providers, wow. But it was most of the advice I got was, Jim, you have no idea what you're getting yourself
you're in over your head.
But it was. It was something that the community was saying loud and clear that this is what we want and this is what we need in this community. And so I took that as a challenge to say, okay, I may not have a healthcare background, but I know people in healthcare. I know people in the political world that I can talk to, and I also knew some people in the fundraising world that could help. And so again, I just took it as a challenge, and we started just having conversations with the community. We did a series of focus groups. One bit of advice that I was given early on was that you need to make a case for this. You need to do a community health assessment. So that's what I focused on for the better part of a year. After my time with the senator's office came to an end, I was able to pretty much dedicate almost a year full time of focusing on building a case, and we did an extensive community health assessment of the community and also of the businesses in the area.
Who did you have to present the case to? Is that to government?
No, it was more to once we compiled all the information, we basically, that's what we took to some of the first funders for so that they could see that we even though we knew intuitively what the issue was and what we wanted to accomplish. They wanted to see that there was actually data to support what we were proposing.
Do you remember how much money you raised in that initial round to get that thing off the ground? What did it cost, and how did you do it?
Well, again, another funny story. I brought in the pastor says, we have really no budget for this. We have one of our donors gave us $10,000 that we can allocate toward the project. And
you still got to fix up the house. Yeah. You got to remodel. You got to do everything.
So I brought in.
It was a house that needed to be torn down.
Oh, it was
like
one
if
of
you
those.
had seen the pictures.
Sure.
Yeah.
But it was the question came as, well, how are we going to pay for all this renovation? And so I brought in a contractor and said, can you tell me what it would cost to renovate this 110-year-old house that was falling down inside and out? And he after he stopped laughing, he said, first of all, you should just tear it down and start from scratch. But because of zoning requirements, you couldn't do that. You had to work within the existing structure. So he said, but this was almost 30 years ago. He said, you're looking at about $150,000 to renovate this house to make it a functional healthcare facility. And I said, well, we're about $140,000 short.
We're almost there, this close.
But at the time, the community was just very engaged. I think I had a sense that there was, if we put it out there to the community, they would respond. So we at one weekend I went in front of all the services that weekend and spoke to probably at 9 or 10 different services throughout the weekend, and laid it out there. I said, you all have said that this is a priority, but we don't have the resources to pay a contractor to do the renovation. So if this is going to happen, it's going to be because of all of you. And I said, next Saturday we're going to meet out at the little house, and anyone that can swing a hammer, come out and join us. And at the point I was still new to the community, and I thought, who am I to inspire this kind of involvement? I said, I had no idea if we'd have 2 people or 20, but that first weekend we had over 100 people show up with their tools, and
all there to help.
Yep. And so
what did it cost at the end of the day? Did you guys get a lot of that volunteer work done so that the contractors that you didn't have to pay out as much money?
Yeah, I would say probably 90% of the whole project was just done by volunteer labor. We ended up getting quite a bit of donated construction supplies, and I would say if I was to estimate at the time, it was probably $40,000 or $50,000 of what we had to raise to complete the original renovation.
Amazing. What were the first services that you guys offered? Because now obviously it's this integrated model. I don't know, were you able to start that way, or did you have to start small with just primary care? Or
started very, very, very basic primary care. Shortly after, though, it was very clear that mental health was a huge issue, and so we started bringing in volunteer therapists that were willing to work on this project and provide their services pro bono. And so it was all volunteer medical and behavioral health providers. One thing that was important early on is that what we also heard from the community was about getting good, accurate healthcare information about chronic disease. And so we spent a lot of time of just really focusing on healthcare education, chronic disease management especially around chronic diseases like diabetes and cardiovascular disease and things like that. So it was we focused a lot on health education, along with providing those basic services as well.
Man, so Kristen, fast forward 3 decades, basically.
Yeah.
What has to you, because we've heard this great founder story, and we see the direction. I can hear his passion in every word. Now that you are moving into basically 4Xing your space, going from 6,000 to 24,000, give or take, how has the vision changed into what you guys deliver now from when it was at that little tiny house next to the parish?
Yeah. Well, nobody holds the vision better than Jim. And there are times where I want to shake him. Like, don't you see this problem? And he'll say, yeah, that's going to be tough. We got to figure it out. Oh, man.
The true visionary.
And we do. And that's, the fact that he is still here and leading and holding that compass is really, it wouldn't happen otherwise. So the mission remains the same, is to provide this care to those who wouldn't otherwise have access. What it means for us to expand is we're expanding our impact. We're really able to offer more to more people.
And now, is that in the breadth of services, or is it the depth of the current services so that you can serve more patients?
Yeah, I would say it's both. So, and again, referencing Jim's story, this organization is very authentically built by the community for the community, and so we hold that close. We hold that intentionality, and Jim described the renovation of the home throughout the evolution. So there was this little bungalow, and you can imagine they quickly outgrew that space, and I'm telling the intermediary story. We're able to get what had been a Denver Health satellite clinic in the Globeville neighborhood. So we're able to purchase that.
In addition to the bungalow?
Yes, that's a 6,000 square foot clinic. And as organizations evolve, eventually sold off the bungalow that had been serving the purpose of admin office space when we were doing services at the clinic. And so it was great to have that opportunity to grow. but over time, we got full, and our providers, there was a point in time where we were able to transition from being able to hire providers and rather than depend on volunteer support, which was really important and worthwhile, that volunteer support. But to be able to hire providers elevated and changed the level of care and the consistency, really. And then, there's so many elements of that.
Right.
The record system and da-da-da. So we could go down any number of rabbit holes. But to answer your question, I think as we move into this space, yes, we are able to serve more people and with a greater breadth. One easy answer would be last summer we were able to hire our first pediatrician. So prior to that, our providers are family practice providers. And so they have that knowledge and the ability to treat folks from the beginning of life to the end of life, which is quite a range.
Yeah, amazing.
And
amazing.
Are you a parent?
I am a parent.
So you can imagine, as a parent, you want to bring your kid to a pediatrician.
Yes.
And we started, we were hearing that from our patients, that they were looking for pediatricians at other practices. And it made all the sense in the world to bring on a pediatrician. And that's smart for so many reasons.
Yeah.
Again, when Jim was talking about the families we serve and how they have to prioritize their resources, often they will prioritize for the youngest, for the child.
Yes.
And we're in a really fabulous position when a family comes in, and if we are seeing the child initially, we can meet those needs, but also it opens the conversation for how's your health, Mom?
Yes.
How's Dad doing? And then we're able to provide those services.
So good.
Yeah.
How did the organization get its name? Where does the name come from?
So interesting. It's a beautiful story. But when we were nearing the completion of the renovation of the little house, we realized, we're getting ready to do a grand opening, but we realized we didn't have a name, and we just called it the Clinic Project. And so we were kicking around different names, and nothing was really resonating. And but it was about that time I had just gotten married. My wife, who was an accountant, was an integral part of this whole effort. She actually volunteered as our volunteer bookkeeper accountant for the first several years until our first daughter was born. But so she and I had just gotten married, and we went on a date to the Denver Art Museum, and there was an exhibit on Latin American art. And as we were going through the exhibit, there was a sub-exhibit that told the story of Our Lady Guadalupe and the miracle that occurred at the hill of the healing miracle that occurred at the hill of Tepeyac, which is a location outside of Mexico City. And it was just this really, I knew a little bit about the story at the time, being part of Our Lady Guadalupe Church here in Denver. And but it's just a really powerful and beautiful story about the power of faith and the power of healing, physical healing. And there was a video that told this whole beautiful story, and I turned to my wife. I said, "I think we have a name for our clinic." So the original name was Clinica Tepeyac,
because that's where the miracles are taking place. That's so beautiful.
So,
I love that. And so now as we're getting ready to open this beautiful new facility, do you guys have a target audience as far as patient base goes? In other words, in some community health centers, I know that 85%, for example, of their treating patients might be under what's considered the poverty level. But at the same time, because like you said, world-class care happens at these community health centers, great care from great providers.
Mm-hmm.
You have people that have good jobs, that have good insurance, that make up a minority of those just based on a lot of the times location of them. How does the demo look for you guys? Who are you serving?
So it's about, over 95% of our patients are Latino, the majority of whom are Spanish speaking. We have a large immigrant population, people that are newly arrived to Colorado, and some that have been here for many years, but so it kind of covers the whole spectrum. But again, I would say the majority are in that lower economic demographic in terms of their what they earn at their jobs. Many of our patients are in the service industry, and so they have more modest incomes, and so. But I think in terms of as we open up this new facility, in the Gloveville, Elyria, Swansea neighborhood of just north of downtown, but our patients come from all over the metro area, and so. And that's historically.
You serve thousands, right? You guys serve thousands of patients every year.
We do, and right now we're serving roughly 5,000 patients that come to Tepeyac from all over the Denver metro area. We'll be eventually able to once we're fully operational in this new building, eventually be able to triple the number of patients that we're able to serve.
And that's where Kristen comes in, right? You have to go out and you have to make sure that there's a tie to the community. I'm sure you guys have. You have to write grants. Like there's so many things to make a facility like this work. How do you, Kristen, what story do you tell if you're going in to get someone to buy into the vision? Because it's a beautiful vision. These people need help. Thousands and thousands of people you serve. What do you share?
Well, I share Jim's story, that origin story. And also I find when I talk to people who are listening, they say, "Oh, that sounds great. I wish my doctor did that." And I have to be mindful of where we're all coming from. But what might sound convenient to you or to me is really a game changer for many of our patients. If you're earning an hourly income to take time off from work to come in to see the doctor, and you may or may not have childcare, and there might be transportation challenges. There are a lot of layers.
Yeah.
And what I think seems like a simple conversation, it really is rather complex. So what I like to share with people is the complexity of this project. It is really awesome. The partnerships involved, and then the amount of impact to tell somebody, down the road, we're going to triple the number of people we're going to serve. And I think the other thing, and we're all, grasping for the silver lining of COVID, but if there's anything we learned from that experience, it's that I'm healthy so long as you're healthy. And so
explain that.
Well, a healthy community is in the best interest of everybody.
Yes.
And it really doesn't matter if that person is somebody who you see on a regular basis or you have a relationship with. There's a ripple out effect. And it's just, this is the public health concept. We're all in a better place when we have access to this kind of care.
Yes.
We talk about how the services at Tepeyac save emergency room visits, which become more costly.
I saw that. I think I wrote that down, like $6 million a year in annual savings over the 17,000 patient visits per year.
It's kind of absurd.
It's absurd because, in other words, as I was looking at that data last night, I'm thinking, okay, that's got to be because if you're managing someone's diabetes as an ongoing thing through good lifestyle choices and whatever medications and whatever else they're doing, that prevents a diabetic emergency situation where they end up at a hospital causing a very, very expensive procedure, possibly an amputation or anything like that. Is that kind of how we're
said it perfectly? Yep, that's how we arrive at those numbers.
That's huge impact. I mean, that's one center, $6 million a year. Yeah. That's incredible.
So there's the economic impact, and then there's the personal impact. If as an individual I'm not able to access care, I don't go get care until I am in an emergency. And that's hard on the body, it's hard on the soul, it's hard on the family. So to be able to provide preventative care ahead, up front, is really important. And to provide it without judgment is really, really important. So two things I wanted to make sure to share is, as Jim keeps referencing this little house, and holding on to that intentionality as we grow in this, we've explained, and I'm throwing my arms around, growing from 6,000 square feet to 24,500 square feet. How do we retain that sense of home and welcome and warmth? And we don't know yet, but we're going to figure it out.
Yeah.
Because we're holding that intentionality right there. To the extent the center space of the clinic is what you would probably walk in and recognize as a hallway or a corridor. And our answer would be, no, actually, it's the living room. There's going to be furniture and artwork, and the intentionality is every time someone enters that they feel like honored guests in our home.
Kristen, that's so good. We went through that with a law firm. So when this law firm started, 11 years ago or whatever it was just Dr. Ramos, a medical doctor and an attorney, decides that maybe, he can help some more people because he was seeing where the gap was on the medical side when someone was injured, how they just couldn't get the representation to the depth because the attorneys didn't understand the medical issues quite as deep. So he starts with this little idea to just help a few people, right? It wasn't about growing a big law firm. It never was. He was fine medically. He was doing just fine. But all of a sudden, that message caught fire, just like what yours has. And then it led to, now we go from this little space to a bigger space to a bigger space. And in fact, when I came here, there was 33-ish people, and now we're at 100, right? And this is in 6 years. It's just been this escalation of people. And the same thing that you said, Kristen, about this guardianship of the culture, if we were to use one big word, or the vision, it really stems from the top, from what I've experienced. Now, you were saying, man, we're going to figure it out. What you're saying is exactly right, create the environment, but man, the spirit, when everyone has the same spirit, and that's infused from day one to all new hires, and they exude that out to the patients, oh my gosh, what a win. So I have no doubt that you guys are going to create that just by the spirit that I've seen and what Tammy has shared with me and all the rest of it. So I'm super excited for where you guys are going.
One thing we talk a lot about, not at Tepeyac and really all of the community health centers, we talk about the social determinants of health. So for me, it's simply how we're able to impact a person, a family's health outside of what we are able to do in the exam room. And that means everything else that family experiences in terms of access to safe, affordable housing, access to a safe place to play or to exercise, and so I think that really for us, for Tepeyac for our leadership, was to say, okay, as we think about our growth, how can we think about those social determinants of health? And that kind of led to about when we started planning for this new building, started thinking, okay, we know that we're going to be able to provide high quality integrated healthcare services, medical, dental, behavioral health, but what can we do also to be very intentional about impacting other aspects of a person, a family's health? And so the decision to locate our new health center where it is in the Elyria neighborhood, but doing it in partnership with other organizations that are going to be providing the housing. So we have,
that's huge.
We have the 150 affordable apartments that are located above and around our new health center.
It's staggeringly cool, by the way.
It is
so
it's
cool.
Smart. I mean, kind of what you were describing earlier. I mean, it's a smart plan to put housing, health, and food in one place.
Yeah.
To break down those barriers, as
Right.
Jim was describing.
And think about this. Why is it any different when you look around major markets? And Denver is kind of a major market, right? If you look at a lot of our statistics, what do you see happening now more? You see these areas, and for those of you listening, you won't necessarily know where this is unless you're local, but Belmar, right? Belmar down off of, Alameda and Watts or whatever. They have restaurants, they have clinics, they have a police department there, and they have residences all right there where you never have to leave Belmar except to go to your job if that's what you want. Well, why doesn't that make sense, that economies of efficiency? Why doesn't that make sense in what you're doing? And it's brilliant. So kudos to you guys for having that kind of forethought, because most people don't think in the 360. Instead, they think of what's our thing. And then we hope that you think of your thing, and we'll figure out how to join it. So, man, I'm blown away.
When we first moved into the neighborhood, because that's where our main administrative building is located, there was one place that sold any kind of food, and it was a 7-Eleven. So that's
a food desert.
That whole area is a food desert, but that 7-Eleven got torn down about 5 years ago. So there was not even a 7-Eleven in the neighborhood, and so that's why when we had the opportunity to partner with other organizations that that could also help us address those major social determinants, and with the housing and then having the fresh food market, it made perfect sense to us to be able to really address this holistically in terms of the health of the community, and so it was it just made perfect sense.
So I want to ask you guys, and I don't know which one of you is better poised to answer or not, but with respect to the greatest challenge, and I wouldn't have even asked this had I not had a conversation prior to us going on air today with an insurance agent. And so I'm talking to this insurance agent, and I'm trying to help someone find some insurance, et cetera, et cetera. And of course, whenever you talk to an insurance agent, what are you going to talk about? The rates. They're skyrocketing. It's going crazy. It turns out in Colorado, a lot of the insurance companies are leaving the state. And they're leaving the state because of the fact that in our political system, they are cutting their abilities to make margins. So their budgets or their profit margins have to be approved, and they moved it from 15% to 10%. So these insurance companies are saying, well, listen, it's costing us more, and we have to give more services, but our margins are going down from 15 to 10. We can't afford to be in Colorado anymore, so they're leaving. So that then breeds this conversation of, well, how do the rates keep going up so much if the margins are controlled? And so we're just going back and forth. And he said to me something interesting. He said, one of the biggest, when you look at the loss drivers in these insurance companies, is medications, is the prescription medication issue. And so and then his big thing was, when you look at what can be advertised, who dominates the airwaves in part on advertising is medication, pharmacological companies that are developing these things. And they say, talk to your doctor about this and this and this. And so they're driving these things to the point where the medicines are causing all kinds of issues, not to mention, depending on the medicines that you're talking about, they could cause all kinds of addiction issues. How do you guys address that, especially if you're working in a population that probably has a higher addiction ratio than maybe even the average population? I don't know that for sure, but if you're looking for people that might be coming in for opiates or other things, how do you manage that crisis?
Yeah, that's a loaded question, but I would say, first of all, at our new building, we will have a full-service pharmacy that will be eventually be opening up. It won't be opening up on day one, because there's so many regulations and compliance issues that we have to make sure that we have in place before we open our pharmacy. But we are extremely excited about being able to offer pharmacy services to our patients, as opposed to currently, because we don't have a pharmacy in our current facility. Our providers write the prescription, and the patient goes to Walgreens or Walmart to fill the prescription. The challenge is sometimes they fill it and sometimes they don't. If they go there and they find that it's cost prohibitive, they don't fill it, or they may partially comply with what the provider had recommended in terms of the dosage. And so by having a pharmacy as part of our new community health center, that's really going to be a huge...
Helps wrap that together.
It does. And by virtue of being a community health center, another name is the Federally Qualified Health Center, we have access to what's called 340B pricing, which is a very, very affordable pricing for prescriptions for our patients. And so that's something that we are extremely excited about, is not only that our providers can write the prescriptions, but our patients can obtain the prescriptions at an affordable rate. And I think to your question, in terms of some of what's happening now in terms of the issues around addiction, we have one of our providers is certified to provide that level of addiction care. With the population that we currently serve, that's not a huge issue with our.
Oh, that's good.
I think I would attribute it to the fact that so many, like I said, so many of our families are working families, and they're working to provide for their families. So that issue around addiction is not as prominent as what we typically hear about in the media. But we know it's an issue that impacts our community as well, and that we want to make sure that we have the ability to address that issue.
Like Kristen said, I'm healthy, you're healthy. When you're healthy, I'm healthy. So what is the biggest challenge that you guys have faced and overcome in maybe each of your perspectives as we kind of wind this down? Is there one particular thing like, man, this was the biggest challenge that I faced, and this was the biggest challenge that I faced?
Well, I'm the fundraiser, so it's always going to be the funding. And so Jim might have a different answer. I think just it's an interesting story to tell, because in order to make the case, as Jim spoke earlier, you have to talk about what's lacking, and you have to talk about the problems. But I tell you, this is a good news story. Like, this is community engagement, this is government, this is individuals, this is businesses coming together to make this project work. And so to get people to see the value in making a commitment to a place that they likely will never go to. It's not like I'm asking somebody to make a gift to the museum or a gift to the university. This is a different type of place.
Yes. But
the impact is incredible. And so the challenge is making that case. Often in fundraising, they'll say, the easy answer is, oh, we don't do capital. Well, where do you think we're going to provide the services?
Yes. Yes.
So there's that.
I think the challenge and our mission is to provide high quality services to our community, regardless of what their status is. So when we first opened our doors, the vast majority, if not all, of our patients were uninsured, and so we didn't have the capacity to accept Medicaid or Medicare or private insurance. And so as we continue to grow, and we realize that if we're going to sustain this effort on behalf of the community, we had to move in that area of being able to accept Medicaid and Medicare and private insurance. The reality is, and it's intentional based on our mission, is that we have the majority of our patients, more than 60% of our patients are uninsured, and so that's has been an issue and will continue to be an issue, because we have to make sure that we're able to provide those services and have the diversity of revenue to make sure that we're still able to provide the care for people that can't access Medicaid or Medicare or private insurance for whatever reason, whether it be their immigration status or whatever the case may be. And so that will continue to be a challenge. We're focused on making sure that anyone who is eligible for insurance, whether it be through Medicaid or Medicare or private insurance, that we have our enrollment staff that make sure that anyone that is eligible is getting what they deserve in terms of that level of coverage. But we know that there's still going to be a significant percentage of our patient population that won't be able to access that insurance, and so we need to be able to, through the work that Kristen and I are focused on, and from a fundraising and development standpoint, that we're able to continue to generate that level of support from the community.
Love that. So, final question for you guys, each of you. If you had one piece of advice that you've learned or been given along the way that has helped you become who you are fundamentally and foundationally, that you would pass on for me to learn from and for our audience to get a hold of as well, what would that piece of advice be?
For me, it's never underestimate the power of community, the faith that a community that resides within a community, and I think that to me is what continues to motivate me, because I just every day I think I have to reflect, even on the toughest days, the power and the strength of our community, and that we have so much so the community itself is such an incredible resource, and the community will respond, and they will when it's an issue that is of such great importance, they're gonna respond, and they're gonna make things happen. So, but you have to. It's all about raising your level of expectations, and knowing that there is strength in the community.
I love that, Jim. What about you, Kristen?
I think mine's a little more tactical, and again, it's a good thing we partner, because I sometimes find myself focusing too much on the details, and it has to be just right, and remembering that it is a community effort, and that word community gets thrown around a lot, and sometimes you wonder, is this my community? Is that your community? And really experiencing the welcome of being part of the community and the pride. As a Denver native, I'm really proud to be part of this organization. And it's not, it's not a hard story to learn or to share and to embrace.
That's beautiful.
Yeah.
So, final question. If someone wanted to get involved with you guys, if they wanted to volunteer, if they wanted to learn more, if they wanted to donate, if they wanted to be part, if they needed to come to you for services, how would they get in touch with you? What's the best way to connect with Clinica Tepeyac?
Sure. I think first and foremost, we have I believe a rather robust website, tepeyachealth.org.
And let's spell that, Tepeyac.
Correct.
Health.org.
Yes.
Got it.
And we also have a phone number, the clinic number.
The main number for the clinic is 303-458-5302. As we expand into our new building, we're going to, through technology, we're going to have a patient portal access, so that eventually people can use that technology to make appointments and things like that. So.
Nice.
But if you're looking to learn more, you can look on the website, and you can always reach out to Jim or to me. One of my favorite parts of what I get to do is take people on tours and show them the neighborhood and show them the clinic space. It's a beautiful space to be in.
Awesome. Well, you guys have been great guests. I'm inspired for the vision that you guys have put forth and are executing. It's I just want you to know it makes a huge difference. I mean, even from our perspective, that ripple effect that you guys both shared and both alluded to, we feel that, right? If someone has been in an accident and they're seeing us, what's their base level of health? And oftentimes, if their base level of health is better, they respond quicker after having been injured, and vice versa is true. So the work that you're doing is truly important. It's truly needed and inspirational. So you guys have a friend in Ramos Law, and thank you so much for taking the time to join me today. I really appreciate it.
Thank you for the invitation.
Yes,
absolutely. For those of you watching and listening, please, if this strung or struck your heart chord, reach out to them, find out more, see what you can do to make a difference. And if you're not making a difference there, by all means, make a difference somewhere.